Can you put up the agenda if you don't mind, please?
Share screen, your entire screen. And it is coming on board right now.
There you go. Hey, first I want to thank everybody who participated in our first try to go out into the community and have our meeting at Henderson Hopkins School. And Wendy, I'd like us to definitely send you and I to work on, and Becca send a letter on commission letterhead to the school, thanking them for allowing us to do that. And sorry for any technical difficulties when we do this again. We will make sure that we're on top of that. But I wanted to just take a moment and ask everyone if who's had an opportunity to review the minutes, if there's any questions from the minutes that anyone has.
Wendy, hey,
Yeah,
I'm
Paula.
just wondering the link that's on the calendar invite.
Link that's on, okay.
It's not.
Is that not live yet?
No,
Okay.
it's okay.
I asked him to put that on a couple days ago. I thought he would have had it live. Sorry guys about that. It should be live next month. Because what I'm going to do is start putting all the attachments on our webpage. So in case you don't get an email with the attachments or you weren't on the list, you should be able to go there. So I do apologize that is not live yet.
Okay. Well,
That's okay. I just wanted to let you know. So
Yeah.
you'll probably have to pull up everything for everybody.
Okay.
well, if we don't have any questions on the minutes, can I ask for a motion to adopt the minutes?
Approved.
Barbara moves to adopt the minutes. May I get a second?
I second.
Thank you, Benita. The minutes have been moved for adoption and seconded. All in favor, please signify by raising your hand or saying aye.
Aye.
Okay.
Aye.
Paula, Susan, Tiffany, Mangela, Jacob,
Aye.
Mary Beth, Ruth Ann. Okay.
Thank you. Let's move on to the next piece of this. And I also do want to thank everybody who came out for the kickoff as we move to the agenda here, that they came out for the kickoff up in the park in East Baltimore. And thank MDE and MDH and the City of Baltimore and all the good folks who helped us do that. And all of the events we had throughout the week. As usual, we were all less popular than the Dancing Derek the Dinosaur. And I do think the person who did that lost about 20 pounds doing all that dancing. But we're also grateful to be joined by the Commissioner of Housing from the City of Baltimore for the kickoff. I want to thank the entire team for the work. We have compiled a video for the week, and we will send by email and share with folks. And I will say, I think it's super important. And as I have reminded prior, I want to remind again before we get into new business, there is an election coming up on Tuesday. There will be a new governor. I would really like to have folks on the commission raise issues so that we can get over recommendations to the new governor that you would like to see, and ask you if you would forward transition suggestions to Wendy. We will then compile them, share them with the commission. We'll do an email review of those so that we can share them, because every agency will be going through agency review, and this will help equip Kaylee and Paula and all of the good folks at MDE as that happens and goes through review. I know for one, from the standpoint of where I sit at the Green and Healthy Homes Initiative, we are going to be pushing for more funding for the data systems, the assessment systems, the inspection systems, to support our good staff at the Maryland Department of the Environment to be able to do their job, but also for case management support for every county for lead nurses as we lower the lead level to 3.5 for case management and environmental action. So there is really important things to make sure that we do. Wendy, in December, I hope to be going through federal opportunities for property owners, homeowners, and rental property owners that are coming out of federal monies through some of the new budgets, that we can talk about how we advance lead more specifically out of federal funding, and opportunities for whole house home repair that will include lead. And really appreciate this. And not only will MDE be going through agency reviews, so will DHCD and MDH that are so important to this work. So really ask that people contribute those thoughts that will help us advance the mission, and really want to make sure that as we go into 23, we are taking into account the things that you all kindly submitted on top 3 recommendations. But we'll be looking at, there's over $300 million, I think MDE presented at one of the community town halls, coming to the state of Maryland and Baltimore City for lead service line replacement, and how service line replacement for homes will play into this issue. So I want to just remind folks of that. I know this month I don't know if there's any comments on that, and if there are, Wendy, just let me know if folks raise their hands on that or have any comments on anything there. This month, I know we had said we were going to do the town meeting, or the MDH evaluation, universal testing and updates on home visits, and be doing this meeting around case management, and just in time, sliding in to home base like a good Oriole. I see that Cliff Mitchell showed up in a tie, no less, and ready for action, and hopefully feeling much better. So Cliff, I wanted to turn this over to you and let you do your thing. And good morning, Dr. Mitchell.
Ruth Ann,
Yes.
this is a reminder for Cliff for his December. This is on December, which is
Oh,
next
okay.
month.
Got it. Okay.
Yeah. So I don't think we have any old business, unless
Cliff is reminded. Cliff
Okay.
considers himself
Sorry,
reminded. Cliff appreciates a reminder and frequently needs a reminder.
I was jumping the shark and going to the health department open forum. My apologies in getting them conflated. I am just off the airplane, so I'll just blame it on that. But let's, does anyone else have old business? Okay.
Just one question about old business. Did we review the Lead Poisoning Prevention Week activities and the great success of those activities?
I briefly did, but why don't I know what, Cliff, you were at certainly at the Prince George's kickoff as well, and I will say that MDH and MDE just did a spectacular job in leadership and partnership there. So Cliff, I'd love to have your updates and reactions on that as well.
Well, I could not attend the Prince George's County.
Oh, that's right. Sorry.
No, that's okay. Shubha Chandar did a fantastic job, our deputy in the Environmental Health Bureau, but both MDE, MDH, and GHHI logistically and in terms of support did fabulous jobs. And I think it was great to be in Prince George's County. I think I'm hoping that we do that again on a regular basis. Yeah,
I think it was certainly we got and we saw the retirement of the Prince George's County health director, health commissioner, I think as well. I'd love to send a letter to the good doctor on retirement from that for good service. And I got a note, Cliff, from Evelyn Hoban, who was on the original board of the coalition, who's still doing amazing work along with Wendy Boone in the county. But it was so good to get that lift. I think, I'd like to see next year that we have made really such significant progress, but to make sure we have a community town hall around the state, maybe a couple of them, to really address some of these issues, especially around homeowners in rural communities that struggle, and see if we can make some progress over the next year there. But we had quite a good time. We also want to thank Secretary Tablata and Jack Daniels from the commission and others who came out, and appreciate that. Cliff, as I shared with the commission, Chevelle has put together a small video of the week, and I will share that with everybody after the commission by email. So thank you, and let's go on to new business. MSDE OCC update report. Mangela, you're on.
Mangela, do you want to share your screen or do you want me to go ahead and present for you?
I shared my screen, Wendy. Thank
Okay,
you.
all right, let me stop presenting and then
Okay.
you can go ahead and take over.
Yes. Good morning, everyone. I am Angela Paul. I'm the nurse consultant at the Office of Child Care with the Maryland State Department of Education. And I'm happy to present the short report, the work done towards the prevention of lead poisoning for children attending the registered child care homes and the child care centers. So let me start it. Okay. Wendy, can you see the screen, please?
Yes, you're good. You're good.
Thank you. Okay. As informed, I'm from Maryland State Department of Education, and the Office of Child Care is under the Division of Early Childhood. And I'm starting the report. The presentation highlights include the Maryland State Department of Education and Division of Early Childhood Leadership Introduction, and the definitions that we always talk about, what the child care programs and what's the difference between the licensed and the regulated. And also the last 2 years plus what we did during the COVID and how it really impacted the inspections, and also how we were able to move forward with all those impacts, both mostly negative, but also the positive impacts. Then the current number of children and the child care centers in the state of Maryland, and the cohort that we have towards the lead prevention in the environment as well in the children testing. Then the number of lead inspection report that was done last year, and thoughts for consideration. So as informed, we are at the Maryland State Department of Education, and we are dedicated to supporting a world-class educational system that prepares all students for college and career success in the 21st century. We have a new superintendent, and he's not new, he's almost 1.5 years with the department. His name is Superintendent Mohammed Chaudhry. And we have the Deputy State Superintendent for Teaching and Learning, and she is Dr. Deanne Collins. And the Division of Early Childhood, we have our own mission, which is we are committed to supporting early care, child care and early learning. And under the Division of Early Childhood, we have many branches. And the one is the Office of Child Care, that support and guide early education and child care so that every young child in Maryland has a strong foundation and will be ready for kindergarten. And under the Office of Child Care, we have many branches, and licensing branch who oversees all child care licensing activities in Maryland, ensuring health and safety of the young children to learn and attain age-appropriate growth, development, and learning. So that means that we are focusing more on health and safety when the children are enrolled in the early education programs and childcare programs. And we had assistant state superintendent and the director for the Office of Childcare. Both of them left recently, and they are actively recruiting for those positions. And the licensing branch has the branch chief, and his name is Mr. Louis Valenti. And the health and safety comes under the licensing branch. Okay, so what are the types of programs that we have under the licensing branch and the Office of Childcare? We have 4 different types of childcare programs. One is the family childcare program, or we call them as family childcare provider. This is the individual who offer care in their own home to one or more children who aren't related to the provider. To ensure safe environment, Maryland limits the number of children in a family childcare home. A provider may care for up to 8 children with no more than 2 under the age of 2. And they have a separate COMA regulation and regulated by COMA 13A.15, which require that they obtain the certificate of registration to operate the family childcare home. Then we have the large family care home, that is it's a family childcare home, but has the higher capacity based on the space and other resources that is available. So they can care for children 9 to 12 and with no more than 4 children under the age of 2. They have the separate COMA that's governed by COMA 13A18. Then we have the child care center. That is, the center is run by an individual or agency or an organization, and it is regulated under COMA 13A16, and it serves children of all ages from infancy to school age. It can be anywhere from 25 to 200 children or even 300 children, and owned by the individual or the organizations. Then we have the letters of compliance, which is the nursery schools and childcare programs that are run by the tax-exempt religious organizations. And they are regulated by COMA 13A.17, and they serve children ages 12 years and above, and they cannot provide care to children younger than 2 years. Then we also have an informal childcare, where childcare is when a friend, relative, or nanny cares for a child in a family home or in his or her own home. Though it is exempt from Maryland law, the Office of Child Care Scholarship Program follow monitoring procedures to ensure health and safety of the children. And what happened during the COVID times? So I'm just repeating the history. On 3/16/2020, we started work from home, and we conducted numerous listening sessions, both from central office as well from the regional offices, focusing on the licensed programs to be opened to accommodate the needs of the children of those parents who are the essential workers. And then we suspended the inspection just for a short period of time from March to May, just to figure out what we need to do to continue to enforce the regulations and ensure health and safety. So we initiated virtual inspections starting May 2020. So it just took 2 months for us to come up with the policy and standards of procedure, and also informing the programs to let them know that what needed to be, what they need to have, and what our licensing specialists need to have to perform the virtual inspections. And slowly we transitioned to hybrid inspection that was both virtual and in-person inspections. So all the documents that were required for inspection, the providers were asked to submit it, and the program licensing specialists, they were able to review them, And then they were able to make quick visit in person to ensure that health and safety of the children are maintained, especially during that COVID time. Then we resumed on-site inspections from July 1, 2021, and it's been continued. And about 900 plus childcare programs decided to remain closed during this time, and new programs are being opened, and this aligns with the national trend also. And the childcare programs were supported with the different financial supports, both from the MSDE as well from the state of Maryland, and we thank Governor for his support also. And so it was through the federal and state grants. 3 types of grants were provided during the COVID time just to help them with buying the EPA approved products and masks and other resources. There was a COVID-19 resource funds. And then we also started giving them the stabilization funds and now rebuild fund. And I have provided the link here to learn more about the financial support that's being that started and being continued for the childcare programs. And just like the childcare programs, the licensing office also really experienced a high staff turnover, and the licensing branch lost almost 15 to 20 percent of staff, with the current vacancy of 20 plus staff, and this has been an ongoing trend. And we are unable to fill those vacancies. So I've given you the numbers here just for us to know visually what happened with the childcare programs. So when we started the pandemic, we had 7,933 programs licensed, regulated, with more than 202,971 children. And you can see in March 21 how the numbers were just in a declining, 7,453, and March 22, 7,100. And then as of August 2022, we have 7,114 children. And you can also see the decline in the number of children from March 20 and how it's increasing slowly. So children are coming back to the programs now. And here is the another view for according to the regions, how many programs are opened and how many children we have. So we, as of August 2022, 7,114 programs are opened with 191,755 children enrolled from infancy to school age. And the COMAR that we have in place to ensure lead-free environment or lead-safe environment. So I just use the Child Care Center COMAR. This is consistent in all the types of childcare programs. So COMAR 13A16, 0.05, physical plant and equipment. It talks about lead-safe environment. Under B, if the childcare center is a residential rental property constructed before 1978, which is an affected property as defined by the environmental article, and the operator shall submit a copy of the current lead risk or lead-free certificate. This has been enforced, and when the building is found to be unsafe, we provide them help with to connecting them to MDE, to have the certified lead inspected, and also the certified lead abatement services, so that they are helped to reopen for services. And for children testing, according to our COMAR, the operator shall maintain documentation as required by COMAR 10.11.04. Each child admitted to or continuing care is received age-appropriate lead screening, that is 12 months at 24 months. And so that has been enforced, and we make sure that children are being tested. And how many number of inspections we conducted. This is for the calendar year, January 1, 2021 to December 31, 21. The Office of Child Care Staff, they conducted 9,809 inspections. And fortunately, we had only 14 buildings or facilities that were found to be with chipping and peeling paint that were corrected, and they remain open. We did not close them. The children were relocated to another classroom, and they were able to do the abatement services, and they continue to be operated. So it's really a pretty good number for 9,809 inspections. Unfortunately, I do not have the number of the types of inspections. The system does not allow us to separate it. We are working on the system improvement. Hopefully, in the coming years, I'll be able to tell you the types of inspections also. But the environmental inspections that were conducted, only 14 facilities were found to be with chipping and peeling paints that were corrected. So having given this number for the number of the types of programs that we have and the inspections that we perform, and also the lead testings, as informed in my previous meetings also, I'm just putting these three needs for consideration. One is to the MDE for COMAR change, request MDE COMAR to add, regardless of owner or rental status, lead inspection requirement to businesses operated in pre-1978 buildings that services to young children from birth to 6 years. This is something, this will really cover different types of organizations that caters to the needs of the children, including the homeless shelters. So something for the lead commission with Ms. Ruth Ann's leadership, I would like for us to consider something. This will impact our licensing programs also, so that we are able to enforce this through MDE. And then water testing for the past 4+ years, we have been requesting funding so that the free water testing and mitigation support is provided to the childcare facilities that is operating in pre-1978 built buildings. This will include both family childcare homes and also the centers and the church-based organizations also, at least to consider for water testing for the buildings that are built before 1978 that caters to the needs of the children. We had the voluntary program for testing, but we did not have support from organizations for the mitigation support. So it will be nice if they have that support, and many childcare programs will voluntarily have their buildings open for water testing. And the third one, request to MDH, immunization and MDH, MDE lead testing program to merge the immunization and the lead testing certificate, that is MDH 896 and MDH 4620, because we are the only organization that reviews the 200,000 plus children's records for age appropriate vaccination and lead testing. It will be really helpful to the childcare programs and to the licensing staff if those two forms are merged, and so that they are able to review the forms for compliance, and also promoting more testing and promoting more age appropriate vaccination.
Angela, can you leave that last slide up, please, for a minute?
Yes.
I think if you could put it back up, I really think that this is really terrific and exactly what we want to see, those hard recommendations of things that can happen. But if you could put that slide back up, or Wendy, could you help Angela ensure she can get that slide back up? See two hands. The first hand raised was Susan Kleinhammer.
Angela, do you have it, or do you want me to put it up?
Can you put it up, Wendy, please?
Yeah.
Thanks.
Thank you. Angela, maybe I missed it. What about foster care? Where does that come under?
That's under Department of Human Resources.
Okay, so this is not,
Yeah, and Susan, we can certainly present next month if we have room on foster care, because GHHI does the majority of foster care inspections in the state for health and safety.
thank you.
Okay, and if you have a question, you can go offline and send that to Wes Stewart in our program, and I'm sure he can answer any questions you may have regarding that. Camille?
Quick question from Angela. With the onset of the rental license in Baltimore City, if a provider is renting a space, do they provide childcare with a copy of the rental license as well? Just curious.
I will have to get back to you, Camille. And
I wasn't sure because it's fairly new. So that's why I wanted to put it on the radar.
they do say that whether it's owned property or it's a rental property, but I really do not know whether they have the requirement to submit the document. So, but I will check and get back to you.
And it's not a gotcha. It's just brand new. So it may have been something that you didn't consider. It just occurred to me.
So Camille and Angela, this is really quite good. If you all could work that through in the next week, I think this is an important alignment issue as well, and to be thinking about this. And Christina, you had your hand up. Thank you both, Angela and Camille.
Thank you.
Yes, and I know that in center-based childcare, I mean, you have leases sometimes for 10 years. We do have to submit the information they come out to inspect, whether it's a lease or owned. So yes, you have to provide the information from the property so that they can inspect it for licensing standards.
Yeah, and I don't know what kind of data you have, Angela, on how many of your childcare facilities that are licensed are actually in pre-78 rental property, but that would be quite important to know. And then I'm assuming that in all of those instances, the owner is then completely looped in. A lot of issues we had in years past was unlicensed childcare, obviously, and owners of properties not even knowing that there was childcare activities going, so they could not step in with some level of responsibility. And it certainly is an important piece of this, right? But I'm,
Yeah,
yeah,
really.
yes,
We actually have a lot of unlicensed, and a lot of people don't realize that it requires the inspection, the license, and the precept, 78. So that is a huge issue, and it's gotten worse due to the pandemic of, parents find something and scramble due to being, limited ability to find childcare. So, and then they found, other options, and they're not coming back as quickly. So, and we have a huge workforce shortage. So I think the illegal part is extremely unlicensed, is extremely important that we maybe focus on that as well.
yeah, I think this is important. And look, everybody, I mean, Angela had it up on her screen, right? 15 to 20% loss of personnel, right? We are sending this, a copy of these slides, Wendy, should go to every commissioner just to make sure, and I think they will. But I'd like to hone in on this. I'd like to come back next month with really some deeper thought on this, because I think we have to first really look at, okay, so post-COVID, we have these issues. People made different arrangements through the pandemic and now moving out right through the endemic of all of this. And what is it that we can proactively do first to bring people into compliance and incentivize people to get into compliance for the protection of themselves, for the children, and certainly where there's the rental situation. I think that is key, right? It's even harder at some level in homeowner occupied properties that are kind of operating off the legal books, if you will, but where somebody keeps their grandchild plus 3 others, right? And how do we do that? But we still need to have a bit of a campaign here on what do we do about that. And I might also invite INSEE from Children's Environmental Health, because they looked at this issue of childcare, to see if she might present Wendy in a brief form either next month or in January. But Christina, I see your hand up again.
Yeah, no, I really would love to see other agencies work with us on this, because we try, MSD has tried as well, but there's, in order to do a campaign it would be expensive, and finding a way to message together, coming from a different agency, and then we message it, with MSD as well, would be important, because, people caring for, what happens is, even when you are, not caught, but when we find out that there is unlicensed care, it's very difficult, because the parents don't want to lose that care, even if, that we have people that say that they're related, but they're not. And they, so this is, an ongoing issue, because, they don't want to be looking for, alternative care. So it's very difficult to prove it and have to go to court. And I know the licensing specialists do try, and, and it's just, it's more prevalent, especially in certain counties, but across the state. So I do think it's extremely important, and it is more in family childcare, because it's just, centers don't have, they have some, but not as much of this type of it.
Yeah, I'm going to say we have our Vice President of Communications, who's our old Vice President of Communications, is coming back to join us November 14th. I'm going to ask her to work with these agencies, at least that we could have a social media campaign to say, here's why you would want to get your property tested or ensure kids are getting tested. And here's what are the benefits of joining a licensed community, right? And we need that would be helpful to, can we make the case on that? But I think in the new world definition of so many things, right? Who's your family and different things, it is difficult. So appreciate that. Ms. Burke.
Just very quickly, Mangela and or Christina, can you all shoot us a phone number or a protocol that either my staff or the average person would do to report an unlicensed childcare? I can't tell you that I've ever known that, and I feel like I should, but I don't. So,
It's the region. So we can send you the list of regions across the, and then that's who you report it to, the licensing region.
Okay.
You see something, because that's the zip code and area that they would investigate. That's
And I
definitely push that with staff. Absolutely.
Yeah, and I don't know if we get those kinds of calls or not, but Camille, if you receive that, could you push that over to Tiana Shepard,
Sure.
Our team, and we'll do the same training. But I do want to try to first work with folks who coming out of COVID to say, look, everybody made different rules, but we got to get to the protection of children here. So Wendy, do we have other hands up?
Yeah, Mangela's hands.
Thank you, Chris. And Camille, the problem is with the illegal childcare, we would want the parent or someone to put it in writing so that we could go do the inspection and take the sheriff with us to do the inspection and to give them the notice, and also help them to start with the licensing process. So if you do not have anything in writing, it's very difficult, especially we would want something in writing from the parent whose child is attending the illegal childcare and unregistered childcare.
Would it hold as much weight, I guess I'm asking, from the health department if we put it in writing of what we saw? I guess that's where I was going with that.
Yeah, if you put it in writing, yes, definitely the licensing office would go out for inspection.
Okay. Thank you.
Thank you.
Christina, your hand's raised.
Yeah, and that was a great point. I was going to say that, and that would be another avenue to pursue. I mean, they get letters that says we're going to report it to the IRS. You know, we MSD sends letters with information about being licensed, and not trying to be threatening, as you said, Ruth Ann. We do want to incentivize, and there's money attached to becoming licensed. If you would like to have a family childcare program, there's like a $2,500 startup, grant. So it's, it doesn't cost, the training is free. So there's a lot of good information, but if we could put together sort of a marketing campaign or a social media campaign that showed why it's important for the structure and the home, but also why it's important that, from the fire marshal, because you have to have smoke detectors, you need to learn about sleeps, first aid and CPR, because these are things that are life-saving for children, right? So this is what we're focusing on. It's about safety, but there's many other parts of licensing that are.
So Chris and Mangela and whomever, I'm going to suggest a couple of things coming out of this commission discussion, right? Because I think it's also, right, rental property owners should care about this too, right? It creates a liability and an opportunity, but I think we should do two things. Social media campaign that is pretty concise, is fairly inexpensive to do. So we can do that. But I think we ought to do a webinar, and we ought to market it heavily, because Chris, you just made such a good point about I think this is important when we're asking people to do something that is the word compliance around it. What are also the benefits of that compliance, right? And people should be motivated by, kids will be healthier, they will be protected, but it's unfortunate that that's not always the core thing that really moves people to action, right? In my world, in my faith, that should, but it may not. So I think we should do a webinar around this of what is the state of things, what would happen. Also, Mangela, you made some really good recommendations on uniformity around testing and around format, where we can get together on certain forms and certain actions. I would like to ask the agencies to respond to those recommendations. And Angela, if you would send those particular recommendations, while I understand there may be some things that Department of Health may need to or want to collect on something that could maybe not be on a uniform, what is it that we can do to make life easier for both parents, childcare operators, and our folks in government, right? Because nobody's more beleaguered than agencies trying to get people back to work, right? And as well. So I love the idea of the uniformity of things. I think in general, like when families are seeking grants, there's got to be uniformity. If your kid's on WIC or Medicaid, we shouldn't have to go through 5 hoops to get different things to happen. I think this is a great charge of reducing barriers and increasing access, which is a really important step in closing disparities on health and other disparities. So I will help to facilitate some offline meetings here, and I'd love us to report back over the next 3 months of the commission our progress on that. If you are interested in this, please reach out to Wendy, and then we'll call that together. Yes, and Christina.
I just wanted to mention that families that are eligible for the child care scholarship, which used to be called subsidy, it's a great, we've remarketed it as it should be, as a scholarship, first scholarship. They are required to, in order to receive those funds, they have to be in a licensed registered child care program that would be inspected and have to follow all of the standards and safety guidelines, which is
parents should be pushing this really hard, right?
So, that's what I'm thinking is there's other ways, even pediatricians. I know we have a lot of people in the healthcare, in these agencies on this commission, which would be important. If we had a webinar, we could be putting that through pediatricians' offices or health departments where you meet a lot of new families and pregnant women. So I think it would be really important in choosing that there are scholarships available and that they're for licensed registered programs. And, if you have a family member, or that's fine, but you can only have your own child as part of that. Just, again, awareness and information because, they can save lives and, really help.
I think this is fabulous, and I can see that sort of a social media campaign of why you should choose licensed childcare. Here's the benefits for you, and why you should encourage your childcare provider to become licensed, right? I think we've got to go on that then. Dr. Mitchell.
Yeah, no, I've been listening with great interest, and the one thing I would offer or suggest is some of you may know Laura Allen at the School of Nursing at the University of Maryland. I would suggest including her in this discussion because she's actually been doing a lot of work on health of childcare facilities, healthy childcare facilities.
I know Laura, and I can certainly reach out to her as well to help.
Great.
We have
That would be great.
Yeah, we have a question from Tiffany Price. She chatted, for those scholarships, is the youth required to have medical assistance?
No, ma'am. You just have eligibility requirement of income. And so we worked hard in legislative session to make changes with regard to that as well. Similarly, Roseanne, what you said, there was a fast track where if you were eligible for WIC, it shows you what else you're eligible for, including childcare scholarships. And that that's already in the system, and that you only have to be eligible based on your income. So, and your work, whether you have, you're working or going to school. So, it's all based, and listen, that's been raised. We spent a lot of lobbying time getting, a family of 4 at almost $91,000 qualifies. And so that's doubled almost. And for Maryland, we've been at the bottom for so long. We were for reimbursement rates for quality childcare providers. We were at the 9th percentile. We are now at the 70th in just a few years. So we've worked really hard at the state level and local level to make a lot of changes to make this deserved scholarship available for so many more families, because childcare is a top 3 household expense, and you need a licensed program that has all of these safety and 50 pages of COMAR regulation that I'm not complaining about, that really does give your child the best chance and the best start. So if we can work together on these, I think we could really eliminate and some misnomers about what childcare is and what's available to families, and also awareness of where to find licensed childcare, and there's a locate area program and all of that in every county. So it'd be great.
Fantastic. And I love the engagement on this and the opportunity to actually do something really productive here. So I just think this is great. We're going to move on. Wendy, what is next on our agenda? Thank you, Mangela. That was really excellent. Well done, and really appreciate this. Okay, so Dr. Mitchell, it looks like the next 2 may be yours in a way. Draft regulations on lead testing and the Health Department open forum. So turning the floor over to you.
Yes, so good morning, everybody. So you should all have received already draft regulations from the department on revising our blood lead testing regulations and requirements for healthcare providers. There are no big changes here. We are required to send out for public comment whenever we do regulatory changes, but I especially wanted to hear any feedback from the commission. My intention is, and our intention is, to proceed with these. We're trying to get under the. There's a window that closes during legislative session, and we're trying to beat that window with respect to issuing regulations. And this is simply ratifying what we're essentially already doing in practice, which is requiring healthcare providers to comply with the new lower blood lead reference value. The other technical change is a relatively minor technical change, but it was something I realized when we were reviewing the regulations, which is there was a quirk in the old regulations having to do with people who were claiming a bona fide religious exemption from blood lead testing could do so unless they lived in what was called a high risk area. which was defined in the 2004 targeting strategy, but is not defined in anywhere in our 2015 revised targeting plan. So from a technical point of view, we defined a high-risk area, but there was no definition of a high-risk area. So from a practical point of view, I did not see the benefit of, for people who had a bona fide religious exemption, distinguishing between people who lived in a certain area and people who did not. So I removed that. We removed that from the regulations because it's not really enforceable, and it's not really enforceable for healthcare providers either. If somebody claims a bona fide religious exemption, we basically trust that they have a reason to do so, and that the healthcare provider who is required to sign that provision of Form 4620, which we've revised as well, will have talked through that issue with the family. So those are the two, and I'm happy to have any questions about this, but I think these are relatively straightforward. If anybody has any questions or comments, I'm delighted to hear them.
Cliff, I have just one brief comment. And child at high risk means a child who resides or previously resided. What about adding or visited one of the high risk areas?
Well, and Paul, that was sort of the reason that I don't understand. This didn't make sense to me, frankly. If you're going to have somebody claim a bona fide religious exemption, but then you're going to say we're going to distinguish between people we think are at risk for purposes of a bona fide religious exemption and people who are not, you can't really do that on the basis of geography. You really have to understand the risk of the child, which still requires a discussion with the patient, which is what we require in the regulation for everybody. So from my point of view, I didn't understand why we had defined high risk situations for purposes of bona fide religious exemptions. And frankly, the regulations were not really very specific on what happened, how you actively, or how the healthcare provider did anything different with a family that was or was not thought to be at increased risk for purposes of a bona fide religious exemption. So my point of view is I was trying to make life easier for the practitioners by basically saying, look, everybody who claims a bona fide religious exemption, you should treat the same way. You should ask them what are their risks and have a conversation with them about whether or not it makes sense for them to claim a bona fide religious exemption, or if their child really, they should really strongly consider a test because this kid is potentially at risk for lead. But at the end of the day, I did not feel like the department was, from a practical point of view, going to be enforcing a regulation that distinguished physician behavior on the basis of the risk profile of the child.
Barbara Moore's hands up.
I'm happy to have questions from anybody except Barbara.
Since I'm an imposter today and it showed that I was somebody else when I had logged in.
She's Elon Musk. She's taken over Twitter.
Exactly.
So I'll
All right.
wait until you're ready.
What's up, Barbara?
So I do have a question then. How are we defining the at-risk areas?
We are not. I've removed those from the, there
everywhere.
are no high-risk areas anywhere in Maryland now.
Okay,
Universal,
perfect.
universal
Still
testing.
universal.
I
Okay.
made them go away in 2015.
Okay.
We're now referring to him as Pope Mitchell. He waved a wand, and it is true, right? So great. I also noticed Christina put something in the chat, Wendy, that may relate to the last conversation, I think. And if we could keep that, share that too. Cliff, I do think these are pretty straightforward. Thank you for your work on that. We might move to the forum if there's no other questions or comments.
So let me just say, I am delighted to be here because I'm going to introduce, or let them introduce themselves, just a fabulous group of people from whom you do not hear on a regular basis, but really you should, and so now you are. So I'm going to so let me just introduce first Candace Ann Scott. And Candace Ann Scott, whom we all refer to as Candace, Candace is the program manager for the Medicaid home visiting program for children exposed to lead or with moderate to severe persistent asthma that is now operating in 11 jurisdictions. And those 11 jurisdictions represent, I think I'm safe in saying, well over 80, probably north of 85% of the children with lead detected in the state. So those 11 jurisdictions, it's not that we don't care about the others. We also have people here from the jurisdictions that are not funded under the Medicaid program as yet, but are also doing lead case management. So I think it's easier for me, which is what I'm really interested in, really, if they introduce themselves. So, because I can't see who all is on here. So Candace, if you know people are on here and you want to shout out some names, that would be great. I saw Tiffany already. So Tiffany, you want to introduce yourself?
Sorry, I had to turn the microphone on. So I'm Tiffany. I'm from Washington County Health Department, kind of more in the rural area where we don't have as many resources closer to Baltimore in the cities. We are not a very significantly funded lead program. There are two of us. I'm the primary, and then I have someone that helps me because we do get many cases, 50 to 60 case management, about the same time that we are following.
That's great. And so what I'm going to do is I'm just going to introduce everybody first, and then Tiffany, we're going to have a long discussion. You're going to get a lot of questions. That's my guess. All right. And then I next see, who do I see next? Candace, who do I see next?
There's Nasu from Frederick County.
Good morning, everyone. My name is Nasu Kanta. I'm the coordinator for the lead and asthma program at the Frederick County Health Department. Yeah. That's my introduction. I guess I'll get to answer some questions later.
Hey, Nasu, good morning. And then Colleen Hess.
Good morning. I'm Colleen Hess. I'm the nursing supervisor for Baltimore County's lead and asthma program.
And then Samantha Jacobs-Cribbs.
Sorry, I am Sam Cribbs is fine. This is my Gmail, so it has my maiden name on it too. But I am the program supervisor for the maternal and infant health program at the Howard County Health Department, and I'm actually filling in for Will Doyle, who is our primary lead program case manager today because he is on vacation.
Thanks, Sam. It's great to see you.
Nice to see you.
Let's see. Do we have anybody else, Candace, or anybody else that I've missed?
I think that's all that I noticed. And Tiffany.
Okay. And of course, there's some person named Camille Burke. I have no idea.
And Camille.
I don't know which jurisdiction she's from, but Camille, Ms. Burke, where are you from?
I think it's Baltimore City. That's where
oh yeah, that's right.
Today.
Yes. So Camille is now wearing 17 hats for this meeting.
Absolutely. And actually, I will start off with a just internal request and things that something we need to do better. We tend to have people that tend to move from place to place to place. And I can tell you that I don't have a specific form. I will usually pick up the phone and call another county and say, hey, we think someone has moved here and something is done there, but we don't have a formal process, and I'm not quite sure we need to, but I know that in Baltimore City, we need to do a better job of making sure that that case gets transferred. And this isn't just for Red Cap, this is just in general. So I wanted to throw that out there as like one of the issues that I've always had, and we just kind of do it informally, but I think we need to do a better job of that.
That's great, Camille. So, Madam Chair, I'm going to turn this over to you and the commission to sort of think about how you want to structure the discussion.
I have no idea why I'm showing up sideways. So
yeah, no, exactly.
Right. Yeah, I snuck downstairs to get a cup of coffee and moved it to my phone, and this is what happened. So,
I have no idea what you're talking about.
Yeah. So I would, I do, Cliff, one of the issues that has really come up is there enough resources for case management how do we more proactively move referrals to action? I know for one, from putting my GHHI hat on, we need to renew how we get referrals for both asthma and lead, on helping families that both within the programs that the state supports and those that may be additional, making sure that there are resources for advocacy or housing conditions or the like. But in general, I'd love to hear from, and Camille will understand this, but from the non-Baltimore City nurse case managers about the need for support, what we as a state and as a commission, and then separately what organizations like GHHI might do to better provide either educational materials, support, connections, access, or lift from their work. So I would like to start out to hear from these wonderful nurse case managers and maternal child health leads for the counties to understand both their needs and their aspirations for helping us advance this work together.
So I think maybe starting with Tiffany and Sam might be helpful, because they are both in the position, and maybe Tiffany, you could go first to talk a little bit about that, because you sort of exemplify that.
Yeah, so I can give you a couple different examples of our lack of resources here. I had referred a patient to Green and Healthy Homes and was told at the time that you didn't come up this far. It was rectified and they were able to come up and help this family. But there were some other families that needed HEPA filter vacuums, and we don't have any of that stuff. They might not be on the Medicaid system, where we have no resources to give them at all to help them either with cleaning other than educational materials. So my case management up here, I feel, is very limited, because what I do is basically provide education. We receive a lot of calls about where can they get lead testing at? We don't test at our local health department. We don't have the funds for it. We don't have the personnel for it. I wear many hats. I don't just do lead following and case management to try to kind of balance our budget here. When I'm trying to get results that maybe they haven't been tested in 6 months, and I'm calling the doctors, and the doctor's like, well, they were just in here, but we didn't follow up with it. And then you call the family and they're like, oh yeah, my doctor said I was okay. So we had even sent out to, I think, MDE, when they had asked about resources we could use, is I know that there's a database that we can get onto. Right now I have access to Epic, and that's it. I don't have Quest. I don't have anything else to look up some of these lab results that I'm calling about and chasing around to try to get, and just things that MDE or MDH or even Green and Healthy Homes comes across. Like, we had our tech school tested high in lead in their water, and I received a call about it. I had no idea. There was no notification from the state that, hey, during their 3-year testing, they actually tested high for it. And I'm getting calls from family that wants to know, well, what are they doing about it? And I have no idea. I have to now call the school and try to figure out what's going on, because I don't have this information. It's kind of like we're lost up here with the different resources. We have stuff to send them out and education to give them, but what local resources do we have, or where can we guide them to? And unfortunately, I came into this position during pandemic. So all of this, people retired and they left, and I have no idea, this was like a hands-on learning.
Yeah. So Tiffany, first of all, we do work all over the state. So sorry that you got any information. Probably during the pandemic, we had people sliding into jobs as well. And I apologize for that happening. I'm glad it got rectified. But it's, one of the things that I hope we're able to do is, for every case, figure out how to fund for every case management nurse across the state, some funding for kits that can be helpful for families, and funding for vacuums, so that you're not trying to lend it out and try to run a lending program, but that we can actually get a HEPA filtered vacuum into every family that needs it. It's a very low cost, high return type of item. And I know this will take some funding discussions to do. But on the water, and I know we've got a number of hands up, but on the water, now that there is money coming on lead and water, there's going to be opportunities to address some issues in buildings. And, so I'd love to take that one offline and see if we can work with the person who's running the state lead and water program and see of the funding that is coming, if there's opportunities to address that in the school. But we're eking up some resources around that, and there'll be a small amount of funding for families to do lead service lines in their homes, but certainly in buildings. And so that is something that we should at least look to be actionable on. But I appreciate your feedback. Cliff, I think, or Wendy, can you see who, Camille has her hand up.
Yeah.
Tiffany, remind me again what jurisdiction you're from?
Washington County.
Are you, you mentioned that you didn't test. Do you all want to test?
We don't really have the staff for it.
Okay.
I mean, if we had I know they were recalled quick tests because we got a lot of calls during school of where do I get my child test? Oh, they don't have a pediatrician. We live so close to West Virginia and Pennsylvania that many people transfer back and forth or go across the lines. I mean, it's just a constant shuffling. Pennsylvania doesn't test. Some people keep a West Virginia address because it's easier to keep their services down there, even though they live in Maryland, than it is. And I know that's fraud, but at what point we don't really reinforce a lot of that stuff.
So I am asking because we brought point of care testing machines and I happen to have one or two. I'm happy to gift you a machine. It's just paying for the testing materials after that.
Yeah, I'd have to, my supervisor would have to be involved in that and upper management, that discussion. I think that would be good to have as far as, having something here for some of those families that don't have those resources and need to get tested. And if we can offer them that, hey, we can do a quick test here. If it's elevated, then you would have to go have a blood test from your pediatrician.
No problem. Let me know. I'll get your information and we'll figure it out.
Absolutely. Thank you so much.
That would be
so. I wonder if we could hear from Sam in Howard County, Barbara, before you ask your. Is that okay?
Yeah, it was just a quick comment about.
Oh, go ahead, Barbara.
Try to coordinate maybe with WIC if they're doing the hemoglobin testing.
Yeah, but WIC is not doing any lead testing, unfortunately.
Okay, being outside of the box, if we could add that to their.
I have tried for more than a decade to get WIC to do lead testing. And I will say that is an issue that I still think is a relevant issue in terms of the commission, but that's my personal, not my departmental position. Just to be clear.
What is the opposition? I know we're going to go to Samantha here, but what is the
very complicated issue? WIC is a federal program. They have very, very strict time requirements for how they process stuff. We actually did a QI project literally before 2010, a quality improvement project, figuring out how that could potentially work. And there are a couple of states where WIC does lead testing, but it's very difficult to break into the WIC workflow.
But my understanding is that is a state level decision.
Yeah.
Okay.
Okay. Sam?
Hi, I'll be quick because mine is very different from Washington County's because we don't have a lot of lead cases here in Howard County. We have a few, but most of them are not related to the home environment. It's much more dietary or related to spices, some of the jewelry, some of the international different, I guess, like I said, dietary issues. That's our biggest. I think we've only had 3 new cases recently. I'd have to check. I don't have the spreadsheet in front of me that Will was keeping. Our big focus was on closing a lot of our cases. We had a lot of outstanding. So I'd say the only thing for us, and we are pretty well funded. We do have money for testing. We have not actually tapped into it yet this fiscal year. we do work with our school-based wellness to do some lead testing in the schools with that program. So I think our biggest thing is that Will is our only primary lead case manager. So maybe just kind of looking at his workflow and kind of helping him, because he did have a lot of cases outstanding. So it was being able to close those cases and do those follow-ups that we were struggling with just to get the two decreasing levels. And then just some, I guess, training and guidance on the 3.5 level. We haven't gotten any of those cases yet. That was kind of our biggest thing. And then Will started during the pandemic, and I did as well. So we are very new to the role. So kind of just transitioning into what it traditionally has looked like versus what we've been doing here. Any training and kind of like guidance with that would be really, really helpful. But funding wise, we're actually in, as far as caseload wise, we're doing pretty well.
Sam, can I just ask, where are those funds from?
What's from?
The funds that support case management, where are they? Where do you get those from?
I think they are from our core child health, but our Title V budget.
So I was going to mention, for the benefit of the commission, that the two places, so let me just give you a sense of where the funding comes from for these activities. So there is one line within the Department of Health budget for lead case management, which is about $1.3 something million. That has been basically the same funding forever. That funding is used entirely at this point to support almost entirely, with one or two exceptions, which I'll mention in a minute. That funding goes to support the state portion of the federal match for the Medicaid CHIP program for those 11 jurisdictions. That match, just so you understand, is essentially 2-to-1. It's 65% federal, 35% state. So if you think about what that means, if it's about 1.3 million state funds, that accounts for about 35% of the total budget pre-SIHIS, the statewide integrated health improvement strategy, which I'll mention in a minute. But that 1.3 million, essentially, not all of it, but most of it goes to that federal match. So we end up drawing about a total of $2.6 million for the 11 jurisdictions that are funded under the Medicaid CHIP program. And that supports all of the personnel and all of the work in those 11 jurisdictions. Secondly, some jurisdictions use Title V funding, which is the federal program for healthy children, healthy families, and that is at the discretion of the local health department, because those funds are essentially like a block grant where the local health department makes a decision about how to allocate those funds, and it goes to support a whole range of healthy family activities, of which a small portion may be lead-related activities, but that's at the expense of some other part of the healthy child, healthy family expenditures. The other thing that's happened in the last 2 years is we've received, through the Health Services Cost Review Commission, an additional $1 million specifically related to asthma and the statewide integrated health improvement strategy. And we've used that to supplement the state funds for the 11 jurisdictions. So that's given us, instead of about 1.3-ish million, it's given us about 2.3 million. And that has essentially allowed us to essentially almost double the amount of money available for the 11 jurisdictions. However, that money is guaranteed to go away in 2025. That will be the last year of that, because the statewide integrated health improvement strategy goes through 2026 and then stops. So there is no, and I just want to be frank with people about this, because you should understand what the sort of strategy is and the resources are. Those funds go for lead case management in those 11 jurisdictions, plus asthma, which means that absent any other state funding, we would revert back to the 1.3-ish million that is available for lead case management in 2025, 2026. The other, and the Title V, that continues, but that's an annual appropriation from the federal government. And annually, Tiffany, Sam, is that right? Annually, the health department makes a decision about how to allocate those Title V funds each year for those healthy family activities.
Correct.
And that is the total available funding, I believe, for local health departments available for lead case management.
Ruth Ann has her hand up.
Ruth Ann? Oh,
Ruth Ann, you're muted.
Sorry. When this comes to an end on the funding, is the step to have that reallocated by the legislature for this, or is there a plan that this was supposed to lead to something else?
The one of the stipulations of the funding was that there would be efforts to try to maintain this effort. But obviously there's a new administration coming, so that will affect obviously the discussion that happens both internally and externally about that.
Well, okay, so this needs to go on a set of recommendations. I think both an agency review that will happen in any transition, but also recommendations that we can be making as a commission. I think this is something, although it's not the first 200 days, this is something to be paying attention to on a commitment to children and the health equity advancements for children across the state, across the state. Sam, I love you. I love Howard County, a county that has lots of resources, and I'm starkly looking at what I feel is a disparity, not of your fault because you guys are putting that into your budgets, but in Washington County, in Garrett County, in Allegheny County, where I worry about the older housing stock. I mean, you have it obviously too in Ellicott City and many places throughout Howard County, that we have to get some equity into how we fund this across the state uniformly. Camille, God bless you for offering the testing thing, and so we need to work to do that. But I do think if this gets to sort of an empirical, non-political recommendation that says if we're going to be hearing about early childhood health, as let's call it as a goal of whoever is the next administration, here's something to pay attention to.
And Tiffany has her hand up.
Yeah, and so the other thing that we run into is the doctor's offices and non-compliance with the doctor's offices on getting these kids retest, and we can't do anything. I needed a lead level from one of the offices, and she said, "Oh, fax over your request," because obviously they need to know, I'm coming from the health department. And I fax it over, and it's busy, and I call back. She's like, "Oh yeah, that's because I'm busy faxing stuff. Just keep faxing. I'll be here until 6 o'clock tonight." Well, I needed this, before 6 o'clock that night. It was a Friday, so I could document, call the family. The mom's the one that called me to inform me. I had no idea, we had this elevated level for 2 weeks, and it wasn't anyone's fault. It just happened. That's the way it happened. So I don't know with this new, administration coming in, what can they do with these doctors' offices? We can say all day long, it's part of the COMAR, it's part of the practices for you to receive this state funding and this Medicare funding, but they don't care because they know we're not going to do anything.
So let me just, Tiffany, I can say 2 words about that, actually. The first is that I'm working with Candace and with our epidemiologists. I believe Caitlin, are you on?
I don't see that she's on.
All right. So we are working to create actual dashboards for the healthcare providers on retesting. And that is something that we've been discussing with MDE for a while. And Medicaid also has specifically been doing some outreach around that issue as well, because it's part of the quality measures for HEDIS and value-based purchasing. And I won't say more about the Medicaid part because that's not my part, that's Medicaid's. But we are very interested in providing feedback to providers about how much they are doing appropriate retesting of their patients. And I know Dr. Rogers has been working with some pediatric providers on exactly that issue.
Okay, yeah, because I know we have like a 60% non-compliance here, I think, when we did a survey to try to figure out if our physicians that participate in the Medicare program were in compliance, and 60% is pretty high.
You know, I think that needs to get some sunshine on it. And there ought to be something written about this kind of non-compliance by doctors that in a way that would motivate them to want to get in the game of compliance. But I need to think that one through. But sometimes a little public sunshine on, look, this is the rate of compliance of doctors will get people motivated to action. I don't know, Paul, you're on. Do you have anything to add on this?
I do. We've been wrestling with this in our last 3 meetings with our ECHO program. And the feedback we're getting is that the doctors are having problems getting the patients back in the office. And when they do come back in the office, it's not child visit, it's acute care visit. And they happen to notice they haven't been retested. So we're, as I said, we're applying quality assurance, all kinds of techniques. We're looking at what we can do to improve that. But it's going to take a couple more months working with these practices to get an answer for that. So I wouldn't necessarily put the blame on the doctors right off the bat.
Yeah, no, I agree with that. I mean, I think most doctors want to do the right thing here, and they want to be able to do it. And I think figuring out where the obstacles are and reducing those obstacles is something that we are definitely interested in. I will say also, I do have to remind people, including the doctors, we've just come through a period where all bets are off. We've seen rates for everything, vaccinations, child care visits, everything tank because of the pandemic. So we are in a little bit of a reconstruction, rebuilding phase. And I think it's an opportunity to re-engage with people on this issue.
Somebody has their hand raised. Nasu?
Hi, I just wanted to jump in and kind of give some perspective on the lead case management ordeal. We're actually getting a lot of referrals from our doctors, our primary care providers. So they are calling us when they are getting the higher lead levels in families. And we kind of have a mix between Howard County and Washington County, obviously, because we're kind of in the middle, right? We have a lot of clients that are receiving, that are getting these higher lead levels because of their old houses or like remodeled farmhouses that their parents are moving into and deciding to build lives there and having children there. So it's kind of appalling at the levels, kind of very scary for them. But we're also having the issue of receiving clients that aren't technically eligible for our program because they aren't eligible for Medicaid. They do go ahead and we share education, obviously. We try to get them in touch with other organizations the best we can. But I guess that's the other end of the spectrum where we can't really get them the help they need because they aren't eligible for Medicaid. We do have a lot of children coming in, again, from kind of lead exposure from spices and things like that. And that's sort of like a behavioral change. And their levels are a lot lower than the children that are coming from older homes or homes that are old farm homes that are being turned into like new family homes. So I just kind of wanted to put in that perspective. I do want to highlight there's a bit of a discrepancy just on the idea of having a lead program. I'm not sure. We do a lot of advertising here in Frederick County just because we want to get the word out there. We are very open to our community and we go to a lot of community events. But the lead testing is a huge thing that, like Dr. Mitchell just said, the lead testing is a it's not really happening as much as it should. A lot of children are not getting the, oh, I'm from Frederick County. If anybody, I think we're getting questions. So I'm
Yeah,
from Frederick
thank
County.
you. I just needed to know that. Thank you.
Of course. The lead testing is just not getting done. There are incentive programs that are being done by Aetna. I know that Aetna is doing an incentive program with lead testing, and we try to follow up with them and try to connect with them to get more children tested, because we know the rates around, and we know these people are moving into old farm homes, and we know these people are bringing in spices from other places. And I think we just have to kind of make more of an effort to encourage these people to get lead tested. But again, we don't have the resources to test them in our county because we don't have a lot of the manpower and we don't have a lot of the time to spare to test. We're doing a lot of case management.
Camille has her hand raised.
This is for Nasu, and I know this personally because my daughter is an American Sign Language major, and I spend a lot of time in Frederick County. It has one of the largest deaf communities in the state of Maryland. Do you all do anything specific for the deaf and or hard of hearing community? Let me say it the right way.
We do not. We don't specifically focus on certain communities. We do a lot for what we do right now. We're starting at school levels, right? So all children have to go to school, but we haven't had any interaction with the deaf or hard of hearing community. I think that would be a great place to start. We do a lot of outreach with the Asian American community here in Frederick County as well, and the Hispanic speaking community. So I think it would be a good idea to start with different demographics. So thank you for that.
Ruth Ann's hand is raised.
Well, just that what I'm hearing more than anything else is, again, this right sizing of, if we're going to have universal blood lead testing and pursue that as a public policy, we've got a big gap to fill on resources for these, for everybody that we're asking to take responsibility and engagement. What I'm trying to figure out, Cliff, is how do we get to what the numerator or denominator or whatever that would be, right? What would be the projected cost to do this right? And are we also pushing the message that for those who have insurance, that insurance will pay or not pay? And really, again, do a statewide education on parents about what are their barriers for pushing this, doing the follow-up testing, being proactive with their doctors. I think there's both sides at fault on that one, with all due respect, Paul. I mean, I think there are parents who need help from their doctor's offices for the encouragement of getting this done, and there are parents who need to follow up, obviously. Camille, you have your hand raised.
One is for Cliff, and one is for, since I'm last, I will tell you what Baltimore City would like to have. One for Cliff. In Baltimore City, it is both the gift and the curse that we have programs to fit Medicaid and non-Medicaid. And the non-Medicaid children are growing. What do other parts of the state do for kids that are non-Medicaid? I would be remiss if I didn't ask that. And then I'll tell you what my wish list is.
So, so if you recall, I said that 1.3-ish million goes almost entirely for the state match for Medicaid. However, we have historically, over the last couple of years, reserved a small amount of that for Baltimore City and Prince George's County. Baltimore City gets the vast majority of it, and Baltimore City knows that, so I'm not outing Baltimore City, and it's appropriate because Baltimore City needs it. But Prince George's County gets a very small amount, and then a couple of other jurisdictions, maybe one or two, get not enough for even a full-time or even a part-time person, but basically a pittance to do some case management activities. And that money, because it is state money, is not restricted to Medicaid restrictions. It is available for Medicaid case management. But again, that comes at the expense of the Medicaid match. And we've reduced that over the years because in order to keep those 11 jurisdictions funded at any level whatever, we have taken an increasing share of that 1.3 million pot and put it into the Medicaid match. So again, I want to be transparent with people about this, and obviously the same issues apply with respect to the SIHIS money. That money, the 1 million goes for that supplement, but that supplement will go away when the SIHIS project terminates. The other thing I would just add, and that is apropos, Colleen hasn't spoken at all about this, but I think, and some of the others have not spoken about this, but I would ask, all of the local health departments, one of the things that, and not disparities, but I think one of the things to think about and one of the things for the commission to understand is how much time it takes to do case management. And I wonder if the people on both, all of the folks who are here, it might help you as commissioners to understand how much time it takes to engage with these families and do things like record keeping and how that record keeping takes place and so forth, because there's a lot of work behind the scenes that goes on that you may not appreciate unless you actually are doing it firsthand.
Hi, this is Colleen from Baltimore County. I'd like to add to that, Cliff, just to give some perspective. It is many, many hours per child that is involved in case management. From the time, and our program deals with lead and asthma, so it doesn't really matter what side you're going to, lead or asthma. Each takes hours of case management. By the time we get a referral to the time we are able to reach the family, that can take several days. It can take weeks sometimes once we get a referral. Parents don't, and just like anybody, we're very selective with our phone calls now. We get a lot of spam, so people don't answer their phone calls like they used to. So we've resorted sometimes to text messaging when a child's lead level is significantly high. And we look at that mainly anything over 10 we focus on to try to do whatever we can to get these parents. And then once we do get in touch with them, then we do a screening to see if they're eligible. Then we try to set up a home visit. Coordinating the home visit with their schedules is difficult sometimes because of work schedules, so we have to be kind of flexible. There's times that we're working after hours to meet their schedule demands. Once we do a home visit, and that can vary from 45 minutes to an hour and a half or longer. If they are non-English speaking and we have to use a language line, it adds tremendously to the time involved at a home visit. And then once the home visit is over, in Baltimore County, we use REDCap, that we do our documentation of our required metrics. And the visit, the initial visit especially can take an hour to document all of the points that need to be checked off on the visit. But then we also have to do our own documentation for Baltimore County's purposes. So we're double documenting on each child. And so by the time you get done a home visit, you come back, you document in REDCap, and then you go into Baltimore County's website and you document the progress note and the required metrics for Baltimore County. We're talking probably 4 or 5 hours that you've spent on just this one case. In the meantime, we've already gotten other referrals. Every week now we're getting 10 asthma referrals that's adding to our caseload. So it's getting quite busy. We're fortunate in Baltimore County that this year we were able to, over the last 6 months, hire 2 community health workers. And then 3 weeks ago, we were able to hire a public health nurse. For years, we've been functioning with 2 people for the entire county. And that's not sustainable. So we're very excited that we have more staff, but it's taken years to get to that point. And then the only other thing I just wanted to add is that right now, just like Ruth Ann was saying about employment across the country is in dire straits right now. We're seeing that with MDE. We've had several conversations because we're trying to get families their lead inspections. This is the delay for lead inspections in Baltimore County, because I know Baltimore County lost its pretty much its designated inspector. It takes so long to get trained inspectors. So we're having a very difficult time getting families their lead inspections. And we're also seeing a decrease in the amount of lead cases over the last couple months. I don't know if it's, like the nationwide trend, parents not going to the doctors for well child checks, but we've seen a significant decrease in the amount of lead cases over the last few months. I was thinking it was going to pick up when school started, but it has not. So it's kind of concerning why Baltimore County is not getting as many. Like for the month of October, we had 2 new cases for the entire month. That's not normal for Baltimore County. So I don't know if anybody else in the state is seeing that trend, or is it just Baltimore County? I would be interested to hear.
That was really helpful. Cliff, I think we're gonna have to, it looks like Camille and Nasu have their hands raised. I think after that, we'll need to bring this discussion to conclusion with some next steps.
So
Yeah,
I will.
Go ahead, Camille.
So I will echo everything Colleen said, but I'd like to throw in that column of what I call other stuff that happens seamlessly that you don't notice. So procurement is always an issue in any local government and getting things through to get to the next level. The level of documentation we do is unheard of in the files that we keep. The other stuff is that life happens to a family on the way to being lead tested. So we've provided transportation. We're trying to enter as a city into an agreement with Uber and Lyft to see if we can just provide transportation back to the lead testing to encourage them to be lead tested. We've provided cab vouchers and all kinds of things. We're seeing an increase in folk just being hungry and asking for food resources constantly in Baltimore City. So we are attempting to kind of send folk to food banks. I mean, we are now showing up at food giveaways to distribute lead testing information at that point, and then follow up with a family. And because Baltimore is so culturally diverse, my staff over the years has literally had to become culturally competent very, very, very quickly in figuring out that you don't enter a Muslim home as a male inspector with just a woman being there. You have to live a little differently, take off your shoes, that kind of thing. And those are some of the things we just kind of take for granted. And in the midst of all this, we're still trying to increase testing, which is the one ask that Baltimore City has, is that we do pretty well with case management, and we do pretty well, but the testing piece, the front end piece to get us the cases is where we're struggling to kind of promote testing and kind of move that forward. And we do that certainly during Lead Month, and we're going to keep our ads up, and we're lucky enough to be able to do that. But we'd like to utilize community health workers and or case managers, because they all do it at kind of the same way, to increase testing and be able to do it in a more targeted instead of haphazard kind of way, because it ends up being me, which is not a problem, but there's one of me and the city's really large. So I wanted to throw all of that out there at one time.
Yep. And let me just say one other word, which is I also want to point out, and I know that MDE has been working very hard on getting their replacement for Stellar up. We are hoping that at some point there is a replacement for Stellar that allows for uniform data collection across the entire state for case management. But, you know, part of what we're doing at the health departments is trying to figure out how to make it easier and more seamless for people to record stuff, because that double data entry is something that is a problem for all the jurisdictions, or many of them. And I haven't figured out a solution to that yet. The advantage of our REDCap system is that we can see all the lead cases across the entire state for those jurisdictions that are using it. The disadvantage is that it does require double data entry if the local jurisdiction has another way, another data collection system. And that is a challenge for local health departments generally, not just with lead, but with all of their systems. Is we have not cracked yet an efficient and practical way of collecting data uniformly across the state in all jurisdictions with respect to health and case management activities. So there are lots. So I guess in conclusion, what I would say is, first of all, I think you've seen and heard how fantastic this group is. I'm happy, Madam Chair, in the future to bring additional local health departments on a regular basis or a periodic basis so you can hear what's happening. We didn't have anybody. I tried to get somebody from Somerset County, but the Eastern Shore, you know, it's not just Western Maryland that is under-resourced and also lacking in some of the programs, but also parts of the Eastern Shore where there are significant numbers of lead cases, and Southern Maryland where we do have a number of programs operating for home visit.
Yeah, I think that absolutely, and really, I've just been writing like crazy down points, and again, if people feel free to share with me or Wendy any suggestions out of this. Cliff, I know we'll debrief as well. I want to thank everybody for like really sharing what is happening, what's going on, and the needs here, and the ability for cross collaboration support to advance the goals. You know, and I think eventually we will get all our people coming back to the workforce, but you know, we have to deal with all of those situations as well. And we want to just say thank you to folks who are in the case management side of this work. It takes time and patience and tolerance and grit and a lot of elbow grease to do it right. And you know, we need that, and it can be an exhausting job. So also want to make sure people exercise the rotation of self-care, and that the need in this, and that we support how we resource you so that we can make sure that it's done in the best way possible. Thank you. I feel like this has been very productive on all of our discussions today. Oh, Wendy, what is next on our agenda, please?
If there's any pending legislation, action dates, has anything new come up?
I think we'll certainly ask that the Maryland Department of the Environment be able to talk about what they may or may not have for next session. A lot of the other, I think it's going to be an interesting session. To remind people, we'll go in with one governor and end the session with another. And there, so the priorities around how we're going to look at funding here, but I think there could be some proposed appropriation language for some of the things we've talked about today, for sure. But let's hold that for next meeting, and we'll also encourage to try to get our two legislative representatives to the meeting. I don't know if Delegate if Dahlia is on, or if Senator Carter is on.
No, they're not. They're not on.
Okay. Well, we're going to try to ensure that we get that encouraged attendance. Is there anybody on from their offices?
I didn't see anybody on from their offices.
Okay. All right. Okay. MDE, let's go to our speed dating here, our hot topics. Try if we can keep it to a minute or less for folks, given our time. MDE.
Unless Stephanie has anything, I don't have anything. I just wanted to extend a thank you to GHHI, MDH, and DHCD, as well as our partners at CSI and Prince George's County Health Department for a wonderful lead week.
Well, we appreciate Chevelle and Wes and Celicia, and Alexia, and the entire crew. Plus, the burgers were pretty good. Maybe not the healthiest. We'll work to get some healthier food, but they were pretty good. MDH.
I think you'll hear from me next month about the evaluation report, which is still in final review. Other than that, and you've heard about the regulations, I don't have any other updates. Shuba, Candace, anything else?
No, not at this time.
No,
Okay. Nope, nothing from us.
And I want to thank you for attending the lead and water discussion as well, Shuba, and did such a lovely and great job on that, and opened up a big discussion with folks from Medicaid who came. And really appreciate the time and attention that you gave to Prince George's County and to that forum and others. Thank you.
You're welcome.
Maryland, DHCD, I don't see that we have Jack today, but maybe we do.
Yeah, he's on, or he was on.
You do. I apologize. I was in another meeting.
That's okay. Thank you so much for your great remarks and the kickoff, and talk to us about what's shaken at HCD.
So we're busy on many aspects, not just lead, but we have a continuously moving pipeline for our program, One Healthy Homes for Healthy Kids. We are kind of in contact or in conversations with Dr. Mitchell and EHB and Medicaid on how to sort of revamp and reinvigorate outreach to get more applicants in. I still think on the run rate, we still look like we will be spending out our funds for this year as well, just based upon the run rate and the existing pipeline that we have. But we would always like to be able to get more into the program, get eligible, and be able to do more stuff, and then possibly look to leverage other funds. We about a year ago, 2 years ago, we wrote a support letter for what we call the Baltimore City Lead Initiative, working on the $4 million grant. There was a bit of a stop because of COVID and not being able to get into the homes, but that has passed, and working with the city's lead program, we already have 10 applications in, and they're starting to come in. I had a conversation at the press event on Monday with Alice Kennedy, and we are working on trying to be able to jump on those as quickly as possible to get the services, because they're kind of coming out on a waiting list now that they're back in. So that's sort of getting the pedal to the metal to be able to get those abatement projects started and completed. And I think that's enough for right now. They got a lot of other stuff between some of our other programs that we have been tying in and working with. But right now, we're just really busy. I lost or had 3 individuals retire over the past quarter, as well as 2 who took jobs in academia and left us. So we're also working, just like many others, in backfilling those positions and getting enough staff to be able to not have me work until midnight every night.
Well, thank God you're a young man, but you shouldn't be working to midnight every night. At least try to cut that back to 11:15 p.m.
Yes.
That would be my suggestion.
Yes.
And rest is a weapon, right? So remember
Yes.
that. Thank you for all your good work. And Jack, just a reminder, if there are recommendations that the commission can be making to support HCD's work for the next administration, it would be helpful.
Sure.
Baltimore City Health Department, any other hot remarks coming off the third base corner?
Very, very quickly, just an acknowledgement, like Jack said, that this work doesn't end at 5. So we've adopted one of our families that we served when we went into a home and recognized that there were some other needs, and we're going to hold on to this family through Thanksgiving and through Christmas. So wanted to make sure that we all recognize that the work isn't just about lead, it's about making it a whole child and a whole family. And I'm going to sign off because I'm actually on my way to Mount Washington to join Barbara to do some of those other duties as assigned, to talk to a family.
Fantastic. And Camille, let us know if we can help, and thank you, and appreciate you so much. Paul?
Yeah, just briefly to add, we are third month in our ECHO program. We have 16 practices on board, and they're very varied. Looking at baseline data, 2 practices are 100% compliance in testing and follow-up testing. We have 1, 2, 3 practices that are less than 30%. And our goal is to figure out more, why that's happening and what we can do to help. And I'll be getting back to you in the future.
Great. Do we have HAPC or HCD from the city here?
I didn't see him online.
Okay.
Yeah, I'm here. I'm Catherine.
Oh, okay. There you go.
Catherine, there you are. Wonderful.
How you doing?
Please introduce yourself again so everyone knows who you are. We are so glad to have you on board at HCD. What a wonderful addition from Buffalo, straight up, Catherine Taylor.
Yes, my name's Catherine Taylor. I'm with the Lead Hazard Reduction Program. I'm their program director. Currently, we are active. Like Jack has stated, we have come out of COVID, and we had a stop in unit production for a while, but we have started working on units. We do have 2 grants, and both grants are active. We've been able to work on a few homes so far, and we're hoping to get many more done in the future. Just some growing pains, but we are hoping for a good year to finish off on this year.
Wonderful. And thank you so much, and glad to have you on board and getting that money out the door. And Catherine, we are inviting Stephanie Statz next commission meeting, the new field director who took the retired Carol Payne's place. And I know we want to make sure that you have an opportunity to meet with her. She noted the other day that she's trying to get a meeting with the housing department. So just I'll make that reminder to you, and we can connect offline about that. Wonderful. MSDE, Office of Child Care, you did such a great job today. Again, thank you, Angela.
Just one announcement. I thought Camille would inform that. I'm working with Camille under other staff and also my training division to develop 2-hour training on lead, asthma, allergy, environmental exposure and prevention. It's going to be a 2-hour webinar with providing 2 continuing education credits to the childcare providers. So it's going to be free training, and we are working on that, and it will be published in coming months. Thank you.
Thank you. Christina, any other hot topics?
No, I think very interesting information today from everyone, and I appreciate even further opportunities.
Yeah. And before I get to this, and I'll ask anybody from our team on the line who may have any announcements here, but I just want to say we had some really great discussion today. It will be on all of us to lean in, to push for action. We all have other jobs, even those folks from MDE who have other things. So we'll need to do this together, and I look forward to the engagement on the follow-up steps there. I will start, and if there's anybody from GHHI on the line who wants to weigh in, please put your hand up. But I think the most important thing that I can say here is that we are now officially taking applications for 1,000 homes in the city of Baltimore with a priority on East Baltimore for whole house healthy homes repair. This includes everything from solar for a handful of houses where we're able to do that, thanks to the Maryland Energy Administration, but it includes weatherization, asthma reduction writ large on that, lead hazard control, injury prevention, and things that contribute to ill health in houses. So this is going to be holistically done in 1,000 homes. There will be a strong evaluation on the health outcomes, on the housing stability, school attendance, work attendance, cost, earnings, and equity pathways. But we're also working throughout the city on lead and on asthma, and also seeking to have referrals on patients and individuals with asthma throughout the Baltimore metropolitan region and in the Prince George's County region, and as well as lining up in Baltimore City, Baltimore County, additional energy efficiency work. So if you have families that express housing need, or if you would like a questionnaire in your work, or if you own properties that need this, if from a rental property standpoint, need this work, it is all grants. It is all done by certified bonded contractors. It does include scope and QA/QC on the back end, and follow up with families to ensure the sustainability of the work, and the work is warranted throughout. So we're looking for those referrals to get this off the ground and started. And we want to thank all of the federal, state, and local agencies contributing to this, as well as some very important philanthropic partners, including the O'Neill Foundation, who is based in Annapolis, who's been a consistent supporter of this work. Is there anything else from GHHI? Do I hear from anyone here that we would like to lift up?
Just wanted to echo from our team. Thanks to Cliff, Paula, Jack, all the local health departments who did events, but everyone who was ambitious in doing 2 press conferences and just a lot of tremendous outreach events. We'll make sure that Wendy and Ruth Ann have the media links to share for some of the coverage for those press events. But thanks for everyone, including the comms teams of the agencies.
I want to also let this, although it's not related, let folks know that in the work that we're doing, we're going to be doing electrification and decarbonization work. So that means we're going to be removing gas heat, and in some instances gas stoves, and replacing them with electric, doing electric upgrades to properties where that is a really significant economic benefit to property owners and their and occupants. And we're going to be studying that impact on respiratory health, but also on how these measures improve the envelope of housing. As you know, extreme heat, extreme cold causes buildings to expand and contract and cause other issues like lead hazard and mold. So we will be doing that work as well. And again, just seeking those referrals for our various programs. We also did meet with the Maryland Department of the Environment and with the Secretary, urging again that they advance funds on public education and support, and on legal services that have not come forward in the last couple of years, to help families and owners of properties to be able to advance the rights and responsibilities under law, and to make properties better, and to ensure that we're meeting our legal responsibility for families, that everyone has a right to counsel, which is a law passed recently in the state of Maryland. Any other last commissioner or community updates? We'll welcome, please. Hearing none, please remember to exercise your right to vote. Early voting ends today. Full voting on Tuesday, November the 8th. We will see what the future holds for Maryland. Appreciate everyone's time, and we will see you next month on the 1st of December, Rabbit Day.